Hey friends, I want to share a quick tip to dental offices considering moving away from insurance. Now, this will only relate if you're a doer. And what I mean by that is if your office and as team members, you and your team members often use the word do when talking to patients about the treatment you're about to complete, then this is going to be a great tip for you. First of all, stop it. Stop using the word do when we have conversations with patients about the services we want to complete. We need to start to shift the conversation, especially, and you know what, not even especially, for anyone, whether you're in network or out of network, whether you're moving away from plans or adding plans, the more times that patients hear, or even myself hear that something is due, the more likely I am to get frustrated or to think of it in this fixed timeline. Due means that there was a date and this is when I should have something paid, or this is when I should have something turned in. In a dental practice, if we want to shift the mindset to healthcare, then we need to stop using the term due and start talking with patients about why we complete these services and when we complete them. And that absolutely has everything to do with standard of care. So my tip is stop being a doer and start talking with patients about why we complete these services and at what timeline we understand is best for them to have these. I mean, you know this as being a clinician, if you're listening, that not every patient needs bite wings at a frequency limitation determined by their insurance, right? If they've never had caries, maybe you guys as clinicians and diagnosticians decide different time intervals. So stop saying do. Start considering what's the language we can use instead. Mrs. Jones, one of the things that I'd like to complete today is bite wings. The reason why we take bite wings are for this, so the therapeutic benefit. Therefore, doctor has asked me to go ahead and complete those today. And in that case, I didn't use the word do at all. So I really hope you'll take advantage of this video, sit down with your team, and even at the very minimum, start to listen to each other and see how often you use the word do. I hope you do it.